A new survey shows millions of Americans are worried about the rising cost of health insurance. A hiring firm poll taken during open enrollment found 43% are afraid they might not be able to afford coverage next year. 1 in 3 people said they've put off medical procedures this year because of the cost, and many said they would take a 6.5% pay cut for universal health insurance. And all of this is coming as lawmakers in Washington are debating health care premiums spiking with federal subsidies expiring during the shutdown.
We want to bring in Covered California Executive Director Jessica Altman to talk about all of this. Jessica, thanks so much for joining us here this morning.
You're welcome.
So if those federal subsidies expire, we are expecting to see premiums in 2026 nearly double. So can you talk about the cost breakdown and what sort of premiums we could be facing?
That's exactly right. So Covered California provides health insurance to people that just don't have it from somewhere else. They don't have the privilege of an employer that offers them coverage and pays for a large portion of it. So we provide tax credits that bring the monthly cost of coverage within reach for so many. We cover a record 2 million Californians today. A few years ago, those were made much more generous, and those enhancements, as we call them, are due to expire at the end of the year unless Congress ends the government shutdown and extends them.
Wow. Jessica, explain the fallout here.
So we are looking at, when you take the tax credits getting lower, some people will no longer be eligible, some people will be eligible for less, and then premiums themselves are getting higher because they always do, but also because of this instability. People are going to pay, on average, nearly double what they pay today for their current plan. We do expect some people will say, I just can't afford this. What I would tell Californians is, we are a marketplace. You can shop. Many people do have options that are more affordable if they're willing to look around. We are still the most affordable place for health insurance for most people on Covered California. But this is a really big impact, one we're very worried about. And again, we do expect some people to just say, I can't afford health insurance and I have no choice but to roll the dice with my health and financial security.
And what happens if people do that, especially the healthy ones, right? They're more likely to say, we're just going to go without insurance. So what does that do to the marketplace if you have them exit?
Yeah, so we do expect the people who will leave will be healthier on average. There are many people that don't really have a choice. If you're pregnant, if you have cancer, if you're managing diabetes, you're going to stay in health insurance and figure out a way to pay for it because you need it, but you are also more expensive. And so the cost for those that remain insured will rise. And of course, those that go uninsured will still need health care and they will struggle to get it, and our system will pay for it in other ways. So there's no good outcome when people leave coverage.
Wow. It's a daunting, possibility. And at this point, I think people are just thinking, do I pay my rent or do I pay my health insurance premium when it comes to that? So.
Absolutely. And I mean, these are really big, hard decisions that people have to make. I certainly wish Congress had acted so 2 million Californians weren't in the middle of this and having to make this decision. What I can say is our job at Cover California is to help. Yeah. And help in this moment means explaining the impact for you and your family, telling you what your options are, and we can walk you through it. We have people in your community. They speak your language. They are here just to help you make this decision. So do not hesitate to reach out if we can help you in this moment.
Yeah, glad you are there to help. Jessica Altman, thank you so much.
Thank you.